How is Sever's disease diagnosed? Have you ever wondered how medical professionals identify Sever's disease in young athletes? This condition can be a common issue for active children, especially those involved in sports. Let's break down the diagnosis process step by step. The journey begins with a thorough clinical evaluation. The clinician will first gather a detailed history of the child's symptoms. This includes asking about pain at the back of the heel, particularly during or after activities like running or jumping. The clinician will also inquire about the child's sports participation and any recent increases in activity levels, as these can trigger symptoms. Next, a physical examination focuses on the heel and ankle area. The clinician will inspect for signs of swelling, redness, bruising, or any deformities around the heel. They will assess the range of motion in the ankle, both through active movements made by the child and passive movements performed by the clinician. One key part of the examination is palpation, where the clinician gently presses on the heel to check for localized tenderness. This tenderness is often found over the growth plate at the back of the heel bone, known as the calcaneus. Another important diagnostic tool is the squeeze test. During this test, the clinician compresses the sides of the heel. If this action causes pain, it is a strong indicator of Sever's disease. While imaging tests like X-rays, ultrasound, or magnetic resonance imaging are not typically needed for diagnosis, they can be used selectively. These tests help rule out other causes of heel pain, such as fractures or infections. X-rays may not show specific changes related to Sever's disease, as the growth plate can appear fragmented during development. Magnetic resonance imaging can detect inflammation in the growth plate but is usually reserved for cases where the diagnosis is unclear. From the perspective of athletic training careers in sports, recognizing the signs of Sever's disease early is essential. Athletic trainers and sports medicine professionals play a vital role in monitoring young athletes, especially those undergoing growth spurts. These athletes often participate in weight-bearing sports like football, basketball, running, or gymnastics. Timely diagnosis through clinical assessment allows for effective management strategies. These may include modifying activity levels, implementing stretching routines, and providing supportive care to prevent worsening symptoms. This proactive approach helps young athletes return to their sports as quickly and safely as possible. In summary, diagnosing Sever's disease involves a detailed clinical history and physical examination, with the squeeze test being a key tool. Imaging is mainly used to exclude other conditions. Athletic trainers must stay vigilant in monitoring young athletes for heel pain related to growth and activity changes.